Okay, so I understand you have a positive confirmation test. Well, congratulations, you're pregnant. So your next step is to make an appointment for your intake. During your intake, you will meet with either me, my name is Cathy, or you'll meet with Roseanne, or Connie, or Teresa, or Brandy. And during your intake appointment, we're going to go over your medical history. And then we're going to go over your family history. And then we have questions regarding your genetic history and the genetic history of the father of your baby. So bring him along. He will be helpful. So the whole purpose of getting all of your medical history so that we could plan your care appropriately and make certain recommendations based on your history and the father's history. So after we have your medical history established and documented on your chart, the next thing that we want to do is to provide you with some education. That's a very important part of your intake appointment. And I did want to mention to you too that no matter if this is your first pregnancy or your 10th pregnancy, whether you're brand new to May-Grant or you've established care years ago, or you're a transfer patient from another practice or another state, you're going to have an intake appointment with us. Okay, so you're going to meet with us in this office here. Okay, so the educational portion, very important part of your intake. What we'll do is direct you to May-Grant's Oh Baby. And if you just Google May-Grant Oh Baby, it'll take you straight to that page. And on that page, you'll see everything that you need to know about pregnancy from preconception to postpartum. And during your intake, we'll go over those main bullet points that most women will want to know about during the very initial stage of their pregnancy. And then after we get through your educational visit, well, then we'll orient you to the practice and to the webpage. And then when you and I are done, then you have an appointment with a midwife. During your midwife appointment, you may have a full exam, or you just may have a partial exam. But one way or the other, you're probably getting undressed in some way. We do vaginal cultures at the intake. These vaginal cultures are for gonorrhea and chlamydia. We do this across the board for all of our pregnant moms. So just be prepared when you come in for your intake to know that you're going to get undressed. What I do like to let patients know though is that once we have that done, you should be pretty good until you're 36 weeks. You won't have to get undressed again. After you have been confirmed pregnant, you would have received an order for prenatal lab work and an ultrasound. And it would be a really good idea if you had those things done prior to your intake so that we have the results and that we can review those results with you. If we were to see anything that needed to be addressed, we can make those recommendations at your intake at that time. So it's always a good idea to have them done a few days before your intake appointment. If you're taking any medications, it would be a good idea to either bring them with you or bring a list of those medications, because so many times you come to an appointment and your mind just goes blank and you can't remember what it is that you're taking or the dosage that you're taking. So it's always a good idea to bring along your medications. And then we can go over with you too which medications may not be safe in pregnancy and those that would be safe and that you can continue to take. Okay, so you've had your intake and you've seen the midwife. Typical line of care, we see our patients every 4 weeks until 28 weeks. And then we see our patients every 2 weeks until 36 weeks. And then we see you weekly until you deliver. Another important part of the intake, we ask you about whether you want to screen this pregnancy for Down syndrome or any other trisomy. Hopefully at your confirmation visit, you had received codes. Somebody's talked to you about that already and you've received codes. But if you haven't received codes, or if you don't even know what we're talking about when we ask you if you want to screen the pregnancy, that's quite all right. We have plenty of time to do that. We can teach you everything you need to know about the genetic screening, and I can show you where all the codes are on our Oh Baby webpage. So again, congratulations. I'm very happy for you, as all of us here at May-Grant are so happy. I'm very pleased that you've chosen May-Grant to provide your prenatal care, and I wish you the very best of luck.